Support for this episode comes from Gvoke HypoPen. Now that Benny is on his own more and more, I'm grateful that he's open about his diabetes journey and always tells his friends how to use his emergency glucagon, Gvoke HypoPen. Gvoke HypoPen is a ready-to-use rescue pen for treating very low blood sugar in people with diabetes ages 2 and above. If you take insulin or sulfonylureas, you are at risk for your blood sugar going too low. Low blood sugar emergencies can happen unexpectedly, and they demand quick action. You need a safety net when it matters most. Be ready to treat a very low blood sugar with Gvoke HypoPen. Find out more, go to gvokeglucagon.com/Stacy. That's gvokeglucagon.com/STACEY. Gvoke should not be used if you have a tumor in the gland on top of your kidneys called pheochromocytoma, or if you have a tumor in your pancreas called insulinoma. Visit gvokeglucagon.com/risk for safety information.
This is Diabetes Connections with Stacy Sims.
This week, I think it's fair to say that we all struggle with insurance issues. Diabetes or any chronic condition just increases the hoops we jump through and the expense and the stress. I'm talking to Emily Adams, an employee benefits consultant, to get some advice about how to better navigate. Emily thought she knew the system pretty well, but then her daughter was diagnosed with type 1, and she learned on a personal level how complex our system is. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. I am always so glad to have you here. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. And this might be a good time to remind y'all I have a new show called Diabetes Connections Type 2, and that is aimed at people who may not use insulin yet. They have prediabetes or they have type 2 diabetes and don't need insulin. There's a lot of overlap, of course, but there are a lot of issues that are unique to each community, and I'm doing my best to thread that needle. So if you are listening and you live with type 2 or you know someone with type 2, I'd really urge you to check out the show, share it with friends and family. I like to say it's information without a lot of nagging. My husband lives with type 2, and I'll be honest, I'm trying to gear it to people like him who may not want to hear from their spouses all the time about how they are managing. As you were listening to this episode, I am just back from Friends for Life. I am taping this before I go. This is the largest family conference in the U.S. for people with diabetes. I am assuming it's been a wonderful week. I love seeing so many people. We've been going to this conference for years and years. I brought the kids when they were little. Animas, the pump company that no longer exists, sent me. That's the first time I went. I want to say back in 2013. Might have been earlier than that, but that sounds about right. They sent me and Benny, and I did a lot of video work for them, which was great. But Benny hasn't been able to go in a few years. He's usually at camp. This summer, he has a crazy work schedule. So I am solo, which is an odd way to go to Friends for Life, especially when you don't have diabetes. But I love going, and the connections that I have made over the years are so valuable. If this is the first time you're hearing of it, I will put a link in the show notes. The group is Children with Diabetes. The event is Friends for Life, but they have a couple of regional conferences during the year as well. They will be in Anaheim, California this fall, around the same time as my Mom's Night Out conferences. We'll talk about that a little bit later on. Let's talk insurance. For a long time, we had it very good. I worked for a very large media company. My husband owned a restaurant for many years back in the day, so I was the full-time working lady with the health insurance. We changed hands a few times, the radio station did, but the insurance always stayed stellar. When I left my radio job, we used Cobra for a while. It was expensive, but it was safe. That's important to me. I never want to be without health insurance. But then my husband got a full-time job with, again, really great insurance, so he didn't worry for a few years. But then he left that job and he works in my business now, and we are on our own. We currently buy on the marketplace. Every year, things change. We are currently having an issue with filling prescriptions out of state. This is ridiculous and makes no sense to me. But everybody I know struggles with understanding and navigating their health insurance. And that is why I wanted to talk to Emily Adams. Emily has been an employee benefits consultant for a national brokerage and consulting firm for the last 11 years. Then her daughter was diagnosed with type 1, and her insurance skills got a workout. We're going to talk about that, her family's story, including a trip abroad where they forgot some very important supplies and how they managed, and what she wants us all to know. My conversation with Emily Adams right after this. When I think about our family's use of CGM and Dexcom, it's hard to remember how we did things before. Truly, how did we manage when Benny needed something like 10 finger sticks a day when he was a toddler? We thought it was amazing to switch to Dexcom when it needed to be calibrated 2 times a day. Now, Dexcom G6 eliminates finger sticks for calibration and diabetes treatment decisions. Benny's fingertips looked just awful when he was in elementary school. When they got wet, you could really see how pitted and scarred up they were from all those finger sticks. Now they're healthy and smooth, which I never thought would happen back then. He doesn't even remember. But to me, it's everything. Learn more. Go to diabetes-connections.com and click on the Dexcom logo. Emily Adams, welcome to Diabetes Connections. It's great to talk to you again. How have you been?
Really great. How are you?
I'm good. Thanks for doing this.
Of course.
Before we jump in, let's set the table a little bit. Can you explain what it is you do?
Sure. So my day job is that I'm an employee benefits consultant, and I've been working for USI Insurance, which is a national brokerage and consulting firm, for the last 11 years. My focus is really working with middle market employers that self-fund their benefits plans. So it allows for me to have a little bit more creativity, flexibility, and implementing cost savings metrics. So diabetes related programming and benefits has always been kind of at the forefront of what I like to implement in plans. But, as of January 4th of last year, it became a very personal type of conversation. Yeah. And now I really understand the struggles that people have.
Yeah, let's talk about that. Your family entered diabetes in January of last year?
Yeah. So in fourth quarter of 2022, Kendall was just sicker than normal. And it was during that time when COVID, RSV, and the flu were really prevalent. Everyone around us was sick, but she normally is a very lively, and at that time, 8-year-old. But she was given a strep test that was positive, and then soon thereafter got the flu. And she just really didn't bounce back. She was really tired, just not her normal lively self. And honestly, we didn't really notice, the increased bathroom usage and increased drinking and all of that that's typically tied to T1. But I just knew something was wrong. So it's the mom spidey senses. And I just told my husband, hey, I'm going to take her in. I'm going to call in a sick visit to our pediatrician. And, always, he thinks that I'm a hypochondriac, which I am, but, you have to follow your instincts sometimes. So I took her in, and we're in the waiting room, and it was full of sick kids. So I was like, oh, maybe I am just being a little nuts. We're going to be fine. And we sit down, and Kendall was like, Mom, I am so thirsty. And I was like, okay, well, there's the water fountain. Go grab a drink. And she did. Came back and sat down. And then we got into the exam room, and she was like, oh my gosh, I'm so thirsty, and I have to go to the bathroom so bad. And at that point I was like, oh my God, okay, I know what this is. So I was like, all right, let's, I didn't tell her what I thought. And we walked into the hallway, and I asked for one of the nurses to give me a cup for her to pee in. And then she fought me on it because she thought I was insane. And this was the craziest task I ever asked her to complete. And she also just wasn't feeling well.
Right.
But I gave it to the nurse, and we went back into the exam room. And 2 minutes later, he popped open the door, and he had tears in his eyes. And he was like, Mom, can I talk to you for a minute? And I was like, sure. And I saw he had a glucometer in his hand, and he's like, I am so sorry, but her sugar in her urine is so high, we can't even read it. I'm going to need to do a finger stick. And as soon as she heard that, she freaked out. So it was screaming and crying and whatever. And we had hold her down to get it. And her blood sugar was in the high 400s. So pediatrician came in and was like, I am so sorry. This is type 1 diabetes, and we're going to need, I just called an admission for you. We're going to need you to go home and pack a bag, and you're going to be at the hospital for a couple of days. So, and then, there we went. So, I think for my husband, it was difficult because he was like, this isn't diabetes. Like, come on, we're going to get a second opinion, whatever. And my college, my degrees are in exercise physiology and human nutrition. So like I knew the signs, I knew what was happening. I knew that this is not something you can reverse, because I think he was thinking like, oh, well, type 2 diabetes, like we'll just change our lifestyle and, she'll exercise more and she'll eat better and we're going to be fine. So kind of getting him to that understanding and realization was also a little bit difficult.
I'm curious what your perspective, though, was at the time. You're thinking like a mom, but you're not a nurse, right? You're not a healthcare provider. You see a different side of healthcare than most of us. Any of those thoughts go through your mind about insurance at those moments?
Yeah, I was like, well, here we go. Like, we're going to hit our out-of-pocket maximum every freaking year till the end of time.
Yeah, that's something that most of us realize a little bit later on.
Yeah. But, one of the things that really hit me that I'm starting to like have more vigilance around and seeing if I can make more of an impact is that they were going to send us home without a Dexcom. And I was like, I'm sorry, what? No. Just so you know, I am not signing discharge papers until you put a continuous glucose monitor on her, because we are not going to chase an 8-year-old around. Like, this is already traumatic enough. Go get one, or we're going to be here for an undefined, length of time. And they were like, oh, like, you know what that is? And I'm like, yeah, and you should be telling everybody what that is. But, a lot of the times, well, I guess I could probably say the majority of times decisions are made around cost. And it's something that continues to drive me insane about just medical care and like the health insurance industry. It's all about profitability. It's not necessarily about improving health metrics.
Right. It's funny, Emily, because my gut instinct whenever somebody says that is to talk about my experience with Benny, which is, of course, we went home with no Dexcom because there wasn't around. And, he didn't get a Dexcom till he was 9 years old. But when you phrase it about cost, I mean, obviously we all know you have to know how to do finger sticks. You have to know how to use a meter. I want Benny to wear Dexcom 24/7. Please do not get me wrong.
Yeah.
But when you phrase it in those terms, it really is maddening. We're going to get to some advice a little bit later on. But what did you do when you kind of started looking at the paperwork in front of you, when you did get home and now you and Kendall and your family are in more of a routine? Those first weeks are probably a blur. But is there anything that you did that you felt was a good idea in terms of your insurance and setting things up that way? Or navigating, I guess I should say. You don't really set it up. You just navigate the best you can.
Yeah. So our deductible runs on calendar year. So it's, she was diagnosed on January 4th of 2023, and we left the hospital on January 7th. And I knew we had hit our out-of-pocket maximum by that time. So while we were in, and we have a high deductible health plan, which allows us to contribute to a health savings account, and we use that pre-tax money to pay for expenses like all throughout the year. But, normally, and I tell people all the time, like, never go to a hospital-based setting to get radiology. Like, don't stay away from them for x-rays and CAT scans, and never go through a hospital-based pharmacy because there's so much profit that's baked into each one of those prescriptions, yada, yada. But honestly, like, we were laying there in the hospital room and I was like, now I just don't care, because we've already like outpaced our deductible and out-of-pocket maximum. Like, I might as well just get as much as I can.
Yeah.
So I'm one who refills prescriptions the day that they become available. I try to push refilling things before they, quote unquote, become available to refill. Stock up on insulin like it's going out of style, all the things, because once you get past that out-of-pocket maximum hurdle, it doesn't really matter. And you're on the insurance company's dime. And for what I do on a daily basis, like, I know how much insurance companies make. I know that they're all publicly traded, that their profits have gone up 400% since the beginning of COVID. And especially going back to the institution of the Affordable Care Act, they're businesses, they're for-profit institutions. So I don't feel bad about going past our out-of-pocket maximum and then putting it all on our PBM's dime. And I tell people to do that all the time too.
Backing up from your personal experience, although I do want to come back, I have a couple of questions I'd like to ask you a little bit later on. What is the advice that you'd give people in the diabetes community? I mean, let's start with their employers. If somebody gets their insurance at work, which most people do, and something isn't covered or it just doesn't seem right, do people have any recourse? Right back to our conversation. But first, Diabetes Connections is brought to you by Omnipod. I love when I don't have to deal with a faraway mail order system, when I can just pick up diabetes supplies from the pharmacy. Omnipod is the only tubeless full-feature insulin pump available through the pharmacy. It makes it simple to pick up pods and insulin in the same place, and you avoid those high startup costs from traditional tubed insulin pumps. You simply pay as you pod. Remember, pharmacy means no commitment, and pharmacy means you can switch now, even if your tubed pump is under warranty. Learn more, go to diabetes-connections.com and click on the Omnipod logo. For full safety risk information and free trial terms and conditions, visit omnipod.com/diabetesconnections.
Yes and no. Boy, this is a hard one to answer because there's so many layers. So let me start with like the Insulin Act that Biden and, the different senators, like the bipartisan act that was tried to be put through last year. So that was exciting for, I think, all diabetics and their families, thinking like, oh, okay, great. Like this is going to be a $35 cap on my insulin. But what it turned out to be was a $35 automatic cap on insulin for Medicare, Medicaid, VA benefits. Right. So it didn't at all affect the private payer system, which is the system that I work in. Although, Eli Lilly and Sanofi and Novo Nordisk will say, oh yeah, we have a cap. It's available to all. What they don't describe or provide is an understanding on how to get that $35 cap. I love Amazon Pharmacy right now for the reason that they automatically apply any drug manufacturer assistance to any of Kendall's insulin, to her CGM supplies, to her Omnipod 5. It's all automatically done. And for a user or a member, unlike me, who doesn't understand the system, it is very hard to navigate. Oh, so in order for me to get $35 insulin, I will have to go to Eli Lilly's website to apply for their program and then take the essentially coupon code and provide it to my pharmacist and hope that they process it correctly and be afraid to ask questions or press why it wasn't processed correctly. So there are so many extra steps that I believe are purposeful that the drug manufacturers make sure that people have to take advantage of those who don't understand how to use the system. First and foremost, like I would say, one of my tips right now is to check out Amazon Pharmacy because it's foolproof. You just put in your meds and they'll go out and find that assistance and automatically apply it for you.
I just want to jump in, and the last thing I want is for this to become any kind of political podcast. But you mentioned the bipartisan, insulin. I think it is just worth noting that the Democrats did have a provision to cap insulin for private insurers in the Inflation Reduction Act, and the Republicans took that out. So it was there, and it was out. And that's why it's in only for a certain part of the population. So we'll see what happens. I have an episode, I'm not quite sure if it's airing before or after this one, where we've got the lawyers who are suing all the insulin companies. So it's a great example to start with because it is complicated, especially if you want to use an insulin that's not your preferred on your insurance, God forbid, which is what we do. And the hoops we have to jump through are bananas. But I was also asking because I've heard some people who, and I'll give an example of Omnipod. This is just because it's someone I know personally. This may be with other devices that they were not covered for this on their job's insurance. And they were able to go to HR and say, we would prefer to use this type of insulin pump. And the person in HR was able to get that change done. I was shocked by that, but I guess it can happen.
Yeah, definitely. So with Omnipod, when the 5 came out, there was so much drama around whether or not it would be provided through the pharmacy benefit, or through durable medical equipment.
Right.
And so it is provided through pharmacy, which on any plans that cover it, it should come through the pharmacy benefit. If your employer is a self-funded plan, then essentially plan changes can happen if you ask for them to, if they are approved. Of course, it can't be on like a one-off basis. Like we couldn't just approve the Omnipod just for my family. It would have to be for everyone. Those are the types of plans that I generally work with, because you have so much more flexibility to make decisions that are most impactful for the people who are working for you. If your plan is what is called fully insured, there's virtually nothing that anybody can do to like get an exception. And those are the plans where the formulary is set for a certain reason. And, certain insulin will only be covered under certain brand, generic, or specialty. And all of that is like a whole nother conversation because the drug insulin manufacturers, they mark up their prices in order to get certain slots on people's formularies. So it's never really a decision for you or your family or your endocrinologist on what insulin works best is provided for you all of the time. It's most always driven by insurance, coverage, and cost, which makes me absolutely insane. And if I could tell you just another little story.
Sure.
So, she was diagnosed in January of last year, and my stepbrother was getting married in Spain in May. And we were invited. And at that point in time, we were like, you know what, diabetes, like we got this. Like she had her pump now, and she was a little bit more stable, still in honeymoon, but, we felt like we could do this. So I, read all the blogs, I packed all the stuff, like I had extras for my extras, and, we felt good. So we fly from Cleveland to JFK, and then JFK to Barcelona, and then Barcelona to Valencia. So when we got to Barcelona, we're going through, or Madrid. Jeez Louise. We flew to Madrid. Oh my God. My diabetes brain. Okay. So we flew to Madrid. We go through customs, and Kendall says, hey, I'm kind of hungry. Can I have a snack? I'm like, yeah, sure. No problem. Where's your controller? I'll dose you. So we're looking everywhere. Can't find the controller. We left the controller on the plane, which was not helpful, but I was like, ooh, okay, well, good thing I've got lots of extra supplies. Like I brought all of your pens, and sorry about your luck, but you're going to have to do shots all week. That's just what we're going to have to do. Right.
Right.
So we dose her. We hop on the train to go to Valencia. We get into the hotel in Valencia, and I smelled insulin. And if you're type 1 fam, when you smell insulin, that's terrible. Like something was not right. So I start going through my bag. I had all of her extra Humalog pens in my carry-on, thinking like, it'll be on me. They'll be fine. They're not going to get crushed, whatever. They got crushed. So we had suddenly no insulin pump and no insulin for MDI.
Oh my God.
And I was like, oh my God. Well, I'm either going to like have a nervous breakdown, or I'm going to figure this out. Like they have to have type 1s in Spain. There's got to be insulin in Spain. Insulin started or, has been around for 100 years. Like we got this. So I told my husband, I was like, all right, you take them to the pool, and I'm going to find a farmacia. I saw them everywhere. Like, we're just going to figure this out. So bless my husband's heart, but he also forgot to set up the international service on our phone. So I found the farmacia. I found this sweet pharmacist named Susanna, who was, I will never forget, Susanna didn't speak any English. And I was trying to convey what I needed. And I kept having to go back and forth between the hotel lobby to get Wi-Fi, to write down and snap pictures of her, the insulin in the dosage and everything from her My Chart and all the things. So anyway, I go back and forth like 5 or 6 times. And finally, Susana goes, oh, un momento. And she comes back and she has 2 boxes, a box of Humalog pens and a box of Lantus pens. Of course, they were made by Eli Lilly. They were made by Sanofi, but they had Spanish writing on the box. And I was like, oh my God, I am like, I could hug and kiss you right now. So I'm like, that's exactly what I need. So she charges me $106, $106 for like at least 3 months worth of insulin. And I should have been like skipping through the streets of Spain because I was so excited that we were just going to go on with our best lives in Spain for the next week. But I was so mad because I knew when she was first diagnosed that we were charged thousands of dollars for the exact same stuff. So I go back to the hotel. I logged into my Optum account, and sure enough, the exact same stuff, over $3,000.
I think that social media has really helped the outrage, so to speak, because we did not see, people might come home from trips or things like that. You'd hear these things, but, and certainly the price of insulin didn't really start going up until the early 2000s, but it's amazing. I mean, I know so many people with a similar story who, it's just pennies on the dollar. It's a totally different ballgame. I hate to ask, how was the rest of the trip? Did she do pretty well with shots? That's no fun to go from pod to shots all week.
Yeah, she did. I mean, she's such a trooper. We had some blood sugar volatility, but, we did the best we could. And it certainly was helpful that she, was really active and stuff the whole week too.
Yeah.
But ever since May of last year, I've been like completely outraged by the whole thing. And, just recently I took on a new client and I was digging through all of their pharmacy claims and saw a claim for a year's worth of Humulin, which has been around forever. And they charged the health plan $134,000 for Humulin for the year for this gentleman. How is there no oversight? How is nobody looking at this? How is this not important? Like, I don't get it.
And dialing back a little bit, I mean, obviously, insulin is a huge problem, right? We see, as I mentioned, I'm following a lawsuit pretty closely, and there are several. But what about other supplies? We've already mentioned different brands of pumps. We know that pumps have infusion sets and needles that go with them and all this other stuff. Any advice to people with diabetes in terms of insurance for those? You've mentioned DME and you've mentioned pharmacy. It's interesting to watch these companies change how they want insurance companies to classify them. But on an individual basis, any advice?
Yeah, always go to the manufacturer website. I mean, the United States is the only country in the world that allows for drug manufacturers and medical device manufacturers to advertise. That, of course, there's a reason behind that, but every single drug or supplier manufacturer has a website with some sort of financial offset or financial assistance, and those areas of those websites will say like, I can't afford my coverage, or I can't afford my pump, or I can't afford my supplies, or maybe they call it a coupon or just financial assistance. There's lots of different ways that the assistance is conveyed, but go to the website and roll in the manufacturer assistance that will offset, your costs pretty substantially. Most of those programs are not tied to annual income. So it shouldn't be a problem for anybody to go out there and get that assistance, but definitely do that. And then, there are other challenges that just are so stressful to try to navigate, like these different pumps they have, like you're like locked in for a certain number of years, and it's trials and tribulations to try to get a new pump before the end of that quote unquote warranty period. one thing that I tell people all the time is you have to be an advocate. You have to be like a fierce advocate. You have to be vigilant. If someone tells you no, call back and talk to someone else and keep calling and keep advocating for yourself or, your child or your family member with diabetes, because although there are so many hoops that you have to jump through, it is possible. And you just have to wear the system down. I hate to say it, but you just really do. It's built to wear us down, but you have to be stronger than it.
One of the things that's helped me over the years is not asking my insurance company or my supply company these questions, but going right to the pump company, especially the verification of benefits department.
Yep.
Because they want you to use their stuff. They help you navigate. I think I don't know. It's bananas.
Yeah. I think that is also a great idea. I mean, there's so much money out there that they will throw it at you. Like if you need it, if you want to try a different pump, often the new pump will provide the funds to get out of your other quote unquote contract. I mean, it's essentially no different than, dealing with cable for your TV, like it's the same way. The money is there. You have to ask for it.
Yeah.
One of the hardest things I think is also like navigating, like step therapy. If your benefits change and, the tier of your insulin changes that you've been taking forever and that works for you, it's not your fault that the insulin is in a new tier of coverage.
Right.
So, having your doctor write letter upon letter, or even maybe have a conversation with the insurance company about avoiding step therapy and just giving you the medication because it works for you. I mean, you really have to just go through so many gyrations to get to the end result that you need.
Would you just
define? It's possible.
Yeah. Would you mind defining step therapy? That's not something I think most people are familiar with.
Oh, sure. Let's say that Kendall's Humalog is in a brand tier, but it goes to a specialty tier with our new insurance coverage. The insurance company essentially requires for you to try something else that's cheaper, like Novolog or something before, and you have to show that the Novolog doesn't work in order to get the Humalog again.
Yeah. You've got to try the drug, show it fails, then go back. So meanwhile, you've wasted time on a drug is not going to work. It's unbelievable. I mean, it's not like you're trying to vacuum cleaner.
Exactly.
So I mean, the worst.
And if you think about like the implications of step therapy challenges with the type 1, I mean, you're messing with their A1C, you're messing with their time in range, you're messing with potential lows, all of the things. And then you're also just wasting money and wasting insulin. Like it's so maddening. But I think more than anything, you should not, and you do not have to just accept what an insurance company tells you or what, a supplier or a drug manufacturer tells you. Like ask questions, demand what you need, and figure out how to utilize your resources and your people and your care team to get you what you need. The unfortunate thing is that, healthcare in America is complex. Like this is not something that we can change. I don't even know if it'll be changed in my lifetime, but I'm sure going to try as hard as I possibly can to do the right things and help people navigate and, get to a point that, they have the care that they need and educate them on how to kind of get through the maze, because that's our only option at this point in time.
Before I let you go, I'm curious, do you have any advice for those of us who buy our insurance on the marketplace? My husband and I are both self-employed. We've done that for a couple of years.
Oh, man. I would work with someone who is really confident in the individual marketplace or, healthcare.gov and like really help you navigate those plans. I mean, they are all essentially like HMO based plans, which you have to be very focused and go in knowing like, these are the doctors that I need. here are the medications that I take. It would be nice to find a plan that can support those medications in a less costly way for me, but make sure that everything is in network, because when you go out of network with some of those plans, it can get pretty costly, or you could be in cash pay situations.
Yeah, we've worked, I can't remember what the title of the job is. I don't know if it's an insurance broker. You would know probably, but we did work with somebody years ago to help us find a good plan.
Oh, good.
And before I let you go, again, I'm going to give you an example. If you can't help me with this, that's okay. But I want to tell this story and see what you have to say, because we're just beginning to fight this. So I'm going to use Emily for my personal advocate here.
Okay.
So my son, we live in North Carolina. My son goes to school in Virginia. We use CVS. We use CVS in Target. That's our pharmacy is called that because it's obviously in a Target. And I have used them. I don't know. When was he diagnosed? He was diagnosed 17 years ago. So we have used them even longer than that. Let's say 20 years, this one CVS. So I assumed, like a normal person, I'd be able to fill his prescriptions anywhere in the country. We've done that many times before. We cannot fill insulin, or we just tried Dexcom transmitter prescriptions and get them covered. We can certainly get them filled, but we cannot get them covered by our insurance out of state. I am about to start investigating why. Yeah. Because initially we said, let's just keep it in North Carolina. It doesn't matter. He'll be home, for the summer and for breaks. We could fill things then. But now twice it's bitten us in the ass where he doesn't have what he needs and it's not cool. And I have to overnight him stuff. Is that even legal? What's going on there?
Yeah. So that goes back to my HMO based comment previously. Like when you buy marketplace plans, they are mostly very local and state based. And so you may need to investigate a plan that has like better out of or more extensive in-network benefits. But honestly, I really wonder if Amazon Pharmacy wouldn't be an opportunity for you here, because you could have it like the claims processed through Amazon, through your insurance in North Carolina, but shipped to Benny in Virginia.
I like that. My only concern about Amazon, and you can assuage me of this because you use it, I like a person. I know my guy at CVS in Target, right? I like a person, and Amazon never, they don't have people, right?
Oh, you need to get rid of that, like ASAP. Because I'm sitting over here nauseated about the amount of profit that you've probably given to Caremark over the years by just using CVS Caremark.
Oh, don't worry. We spread it around because we've had to use all of the mail-in pharmacies, all of the middlemen. Yeah. Don't worry. We spread it around.
Yeah. Well, I mean, if he's on a pretty consistent regimen and he's taking the same insulin, you've got, the Dexcom, and all the things that you need, like, why do you really need to talk to a person? I mean, Amazon wouldn't be a good fit for you if you have to pick up antibiotics because you have a sinus infection and you want to talk to the doctor about when to take it, what to take it with, or the pharmacist. In the instance of our type 1s and their constant supply management and stash needs, I think it's perfect. And then they will also go ahead and automatically apply the drug manufacturer assistance for his Dexcom and his pump supplies and all the things.
So you don't have, we're going to totally try that. I love it.
I can help you through it if you want. No problem. But I'm a huge fan.
Okay. I'll let you know. As usual, selfish means on this podcast. I started this podcast a long time ago for selfish reasons, and they keep paying off.
Yeah. Well, I mean, the type 1 family community has, it's a club that we never wanted to be in, right? But it's full of wonderful people. And we've made it through the last 16 months. The majority of that has been with support from other type 1 families. Like, we have a great endo team, but they're not there 24/7.
Yeah.
I would not survive without my other T1 moms. That's for sure.
Yeah. I hear you on that. Hey, great segue. Last thing I promise. It was so great to meet you at Mom's Night Out in Charlotte.
Oh my gosh. I had the best time. I want to go to them all. It was like diabetes camp for me.
Oh, that's amazing. I'm so glad you came. I'm so glad. We'll come. You're Cleveland, right? We got to come to Cleveland.
Yes, please.
All right. So I have a long list. I'm so lucky that people have responded to this event. So I have a list of all, moms around the country who want me to come to their town.
Yeah. Well, I sent the info to one of my friends in Denver. So she'll get her whole T1 posse to come.
Awesome.
But
awesome.
If you haven't been to one of Stacey's Mom's Night Out, you need to. I mean, I traveled to Charlotte. I went by myself. I didn't know anyone. I had no expectations. And I wished that it was a week long and not 36 hours. I met wonderful people that I wouldn't have otherwise met. I stay connected with them. We, share stories, help, all the things. And I also realized during that time that I needed some time and some space to grieve what was this new life of ours, or I shouldn't say grieve my feelings about being a newly type 1 family. And, just there's so many emotions that go on with this type of a diagnosis. And I needed to feel the feels, and that gave me space and time to do that on my own without judgment. And it was just absolutely priceless. So thank you for identifying that need and putting it together.
Oh my God, I'm going to cry. Emily, thank you so much. Was there anything I missed?
Yeah, I mean, the only other thing that I would definitely recommend is making sure that you are aware of, your state legislator, your, senators, what have you, and make sure that they know the trials and tribulations that our families go through. I've never really been interested in politics, but I'm due to this new life of ours and my unique intersection personally and professionally to this disease. I'm really trying to work more with legislative efforts and with JDRF to try to get our voices heard and our problems to be better managed. I feel like there's, no one more powerful sometimes than some pissed off moms about something. So I just encourage you, get after it, reach out anytime. I'm certainly happy to help anyone through any insurance trials and tribulations that they have. But, unfortunately, a lot of this, there's intersections politically as well with benefits through America and healthcare in America. And we need to kind of band together to try to make a difference. So
I love it. Emily, thank you so much for joining me. And thanks for the personal help. I'll keep you posted on how that all works out. But I really appreciate you spending some time with us.
Oh my gosh. Thank you for the invitation. I've never podcasted before. So
you were great.
You're listening to Diabetes Connections with Stacey Sims.
I'll keep you posted on our Amazon changeover. We are in the process of doing that right now to see if it helps Benny get his supplies sent to him at college. I have never heard of an insurance company not covering out of state. This is ridiculous, but we're working on it. And yeah, Emily had some really nice things to say there about Mom's Night Out. Our next 2 events are coming up this fall, Denver in September and Philadelphia in October. Lots of information about those over at diabetes-connections.com. Click on the Mom's Night Out tab. Sometimes it shows up as events on mobile, but just click on that. You'll find it, or ask me. I'm happy to send you more information. And I think it's worth noting that Emily doesn't live in Charlotte. She came to the Mom's Night Out event in Charlotte in January, but she lives in Cleveland, Ohio. And it's worth pointing out that a lot of people travel to these events, which I did not expect. I thought we would only pull from the local cities. But at every event we've done, we've had people flying in, people driving for a couple of hours. It's been this thing now where people grab some girlfriends and jump in the car and just come. So if you have any questions, please let me know. I'm so excited about this, and we will be announcing our 2025 locations very soon. All right, thanks as always to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.
As you're managing life with diabetes, EdgePark is here to support you on your health journey. Discover convenience and peace of mind with EdgePark, your trusted supplier in diabetes management supplies. EdgePark has a wide variety of pump and CGM solutions from top brands to fit your unique needs. Plus, EdgePark works with most insurance companies and handles the paperwork to navigate insurance complexities for you and make the ordering process as seamless as possible. You work hard to manage your diabetes. Let EdgePark take care of the rest. Go to diabetes-connections.com and click on the EdgePark logo.